of the private sector and 3 of the best nonprofits in our country. From our Hiring Our Heroes program, which is at the U.S. Chamber of Commerce, to the Institute for Veterans and Military Families at Syracuse University, and to a small organization made up entirely of post 9/11 veterans in Atlanta called Hire Heroes USA. My name is Kevin Schmiegel. I'm the Executive Director of Hiring Our Heroes at the U.S. Chamber of Commerce, and I'm a 20-year Marine veteran who retired in 2009 and now lead the Hiring Our Heroes program nationally. For veterans who are joining us today or joining this hangout for the first time, you're joining us on an industry panel with representatives from the healthcare sector, 2 great companies, Logistics Health Incorporated and Humana. Before we introduce our 2 panelists, I'd like to tell you a little bit about VetNet and what we're trying to accomplish using Google Plus technology as a platform. VetNet is a technology-based effort to help veterans, transitioning service members, and military spouses find meaningful employment. It was created in collaboration with a company that we feel is leading in the technology sector, Google, and the 3 nonprofits that I named earlier. I like to think of VetNet as an online television station or a virtual career resource center for veterans and military families. On this platform, on this television channel, we'll be hosting panels, question and answer periods with CEOs and nonprofits, and we'll be hosting workshops via the Hangout technology and the video chat technology that Google has put online for us to use. It's free, it's open to everyone, and the material will fall into 3 specific categories, or channels, if you will, 3 tracks. The first one is a basic training track where veterans or recently or soon to be transitioning service members and spouses can get squared away with resume writing workshops, interview techniques, learn how to land a job in the government. There's also an entrepreneur track where the Institute for Veterans and Military Families is teaching online business courses to help veterans start a business or expand their business. And then the track that we're responsible for, that the U.S. Chamber is responsible for, is the Career Connections track. And this is where we'll let you learn from industry experts about job opportunities, career opportunities that exist, and get advice from veterans who have made transitions into those sectors themselves. So we're really excited about it. I think it's an opportunity to reach literally hundreds of thousands of veterans through this technology, and we're excited about being a part of it. So without further ado, I'd like to introduce our 2 panelists. The first on the screen to my left is Josh Galley. Josh is a Marine veteran. He served as a corporal squad leader in Iraq for 2 different tours, and then had some experience in the administrative and human resources side of the Marine Corps after his tours in Iraq. Josh is a talent acquisition specialist or manager in Humana's military veteran and military spouse program. So he has quite a unique role, and he's playing it in a company that's doing a lot to help our military families. In May of 2012, Humana pledged to hire 1,000 veterans. Josh will talk a little bit about their progress in that regard and why they value veterans and military spouses in Humana. The other panelist to my right is Walter Haig. Walter is an Army veteran. He is the program director for periodic health assessment at Logistics Health Incorporated, commonly referred to as LHI. LHI has a number of initiatives, both in their company to hire veterans, but also charitably in the state of Wisconsin, specifically in La Crosse. They do so much to help our military families, and in 2010, they won the prestigious Freedom Award, which is the highest award given to an employer by the Department of Defense, especially in recognition of their support of the Guard and Reserve. I'm going to open it up to Josh to start the panel, but I really want to go over one more thing before we do that, and that is the purpose of this. I think we're trying to reach out to veterans through this technology to talk about specific industries and to talk about career opportunities in those industries. We've led 4 of these already. This is the fifth in a series of about 12 that we'll do repetitively. But today we're going to talk about career opportunities in the healthcare sector. And for Josh and for Walt, their interest, the interest of the veterans following this, is to learn how they can get jobs and careers in the healthcare sector. So that will be the focus of the panel. So I think I'm going to start with you, Josh. If you could kind of walk us through if vets are interested in pursuing a career, specifically in the healthcare sector, how would you recommend they prepare for one? And as you're doing that, cover some of the unique programs that Humana has. Our team here will call up your site, kind of scroll through things as you're talking through the various things that you recommend to veterans who want to pursue a career in the healthcare sector, and specifically at Humana. Thanks, Josh.
Absolutely, and thank you, Kevin, and thank you, Hiring Our Heroes. Humana is really excited to partner with this new VetNet platform, and I want to thank my associate here, Walt, who's joining on the panel. Always good to have collaboration, and hopefully we can share a lot of good insight to the veterans participating today. As Kevin gave my introduction, I am a Marine veteran, but have an affinity to everybody that served, so thank you for being here with us today. In regards to Humana, as Kevin started to announce, we made an announcement in May of this last year to actually hire 1,000 veterans in Humana, and that was in addition to those that were already on board. And I'm proud to say that we're already at that mark. In a year's time, we've already hired over another 1,000 veterans and spouses at Humana. One of the ways that we have found has been really effective to give you a tool and a platform to find out about opportunities at Humana is our Veteran Talent Network, and I provided that link. Kevin, can you let me know if that's showing?
Yeah, it's up.
Absolutely. Thank you so much. So for those seeing the front page of our Veterans Talent Network, this is really a site. It's a portal that's designed to allow you to have a space to go to with wording and verbiage and different things that hopefully you can understand and connect and relate with. It is separate from our corporate career site, so we still have to have, eventually you have a profile on our regular site. But this one really allows you to build a simple profile. It takes about 5 minutes to build a profile, and you can build it based off of your career background, the skills that you have, and the location that you are at or you are going to transition to. And provides a simplified match. It's not based off of your MOS or any particular military skills, but really what it's designed to do is help to promote opportunities that are in Humana. At any given time, we have anywhere between 800 and 2,000 opportunities at Humana open, and so there's lots of opportunities for you to search. And then what we have is myself and an associate that are both veterans, and we are here to assist once you have gone in and explored the opportunities and understand what Humana is about. We're here to help connect you with recruiters and hiring managers. So I'll close with that, Kevin.
So when they go to you. What we hire for.
We're going to turn it over to Walt now. Walt, if you want to comment about LHI, that would be great. Just chime in when you're ready.
Okay, well, I'll just talk about LHI. LHI has been in lacrosse for 10 years, was founded by our CEO, Don Weber, whom I think some of you all may have heard of before. He was, or as many have said, once a Marine, always Marine. He was a Marine in Vietnam and received his Purple Heart and was a recipient of the Bronze Star as well. He has a deep feeling for veterans, and you can find that just about anywhere within our company. Some of the benefits that he has applied for LHI, if you're in the reserve or in the Guard and you're deployed or mobilized, LHI will cover all of your benefits, including your pay, and there aren't very few companies that do that. There is also a spa or a workout, an exercise area that he pays hourly people to work 3 times a week to work at this spa, and that is also a rare thing. But the biggest thing that I think that we have is our clinic. We have a medical clinic that is available for all employees, for their spouses and for their children that they can visit whenever they need to for free. And you don't find that very often at all. So we're really excited about having people come to work for LHI because of those three things. Of course, we have all of the other benefits as well. But the types of positions that we hire for, nurse educator, nurse case manager, a nurse quality assurance, a nurse practitioner or physician assistants, usually in our PDHRA call center, and our PDHRA stands for Post-Deployment Health Reassessment, a dental review coordinator, a medical provider education specialist, which we usually use MAs or LPNs. We can use corpsmen or medics for that matter as well. If you were interested, you would probably want to go into nursing or medical assistant or dental hygienist to get into those. LHI will hire veterans that are qualified for positions that we have. We're our government contractor, and as a result, we have contracts with the VA. We have contracts with MEPCOM, the Military Entrance Command. We have the RHRP, which is Reserve Health Readiness Program. We're in the middle of that right now. We make sure that all guardsmen, all reservists of all services are medically ready to be deployed and to be mobilized as needed by the government. And we do that on the weekends. And you can find that in any guardsman or any reservist who would have a drill weekend, you'll most likely find them becoming medically ready. And that's one of the things that we do. In La Crosse, Wisconsin, where our headquarters is, we have a number of buildings, but we use these buildings for our call center, and we have service members call in and they make appointments for dental work, or they make appointments to get their PHAs or their immunization or whatever it might be. They make the appointments there. We also, that's where we hire from as well. And we would ask that if you were interested in LHI, that you would go to www.logisticshealth.com, and you can set up an actual job agent as well on that thing. On that website, if you go to careers, the job agent will let you know via the email which positions are available and when they are available. That's an exciting function that we offer as well here. Kevin, I'll turn it back to you.
Thanks. I was on mute for a second. Sorry about that. I think the next question would be really helpful is if we could go to Josh again and really relate your own personal experience. Josh, if you could talk in very real terms about your own experience as you left the Marine Corps as a corporal who walked in many of the shoes of the young men and women that are tuning in today. If you could have been given any advice that you wish you had gotten from someone as you made the transition, what would it be? And share that with the folks who are listening.
Absolutely, Kevin. Thank you. You know, one of the things that I think we could all probably relate with is that the transition from military to a civilian world can be quite daunting. It can be a little bit scary. And one of the things that I believe I would have benefited from is having a resource like Hiring Our Heroes and having this VetNet platform. I think anytime that we can learn from industry agents that are leaders in their area and can provide insight like this, that is one area. One of the other things that I think that has been very beneficial for my transition was I had the pleasure of meeting some of the founders of LinkedIn, another online platform. LinkedIn is a professional social network. It's more designed to help you build your reputation online and then allow you to connect with others in the industry. I think for a lot of us that are on this meeting today, I think that between myself, Walt, and Kevin, any questions that you have regarding your online presence, that is definitely one area you want to be very careful of. You can have an online presence that can help your career and propel you to future promotion, or you can have an online presence if you're not careful that it can actually hurt your career. So I'll start with that, Kevin.
No, unfortunately, I can't hear everything that Joshua or Kevin is saying. However, so if I repeat myself, I hope you will understand that as well. But I retired 6 years ago. I was at the Pentagon in the Office of the Surgeon General, and I happened to meet Tommy Thompson, who is the Secretary of the Health and Human Services, and Don Weber, who is the owner at that time of LHI. And we talked for hours, I think, about medical readiness and how we could improve it. And that was one of the ways that I got my job. Now, not all of you have that capability to meet those types of people. However, I would say to, especially to younger veterans, when the military offers you any kind of a cap or a TAP or an ADAP or an ACAP or whatever it might be, take it. It takes about a good year for you to figure out exactly what they want you to do. I've retired from Fort Belvoir, and I can remember not only learning how to write a resume in civilian language, but also how to dress. If you notice, most military people wear green, and you wear green every day, or blue, or whatever color you're wearing for that day. But you don't have a whole lot of choice in what you're wearing. When I started to work for LHI, I realized I had to get a suit or two or some shoes, and how to mix and match the colors and the belt and the shoes and everything else was really interesting. And luckily for us at Fort Belvoir, we had someone who would help us. But I would say to you to make sure that you go through whatever books, whatever information they give you to help you learn how to do that, because we may publish a position that you are qualified for, but you don't feel qualified. And by learning civilian speak, you might find out that you could actually apply for that position. And that's what I would suggest to you.
That's really, really helpful. Thank you, Walt. I think one of the other questions that a lot of the veterans would have is on the future of the industry. I would like to kind of walk through that with you, Josh, get a couple of takeaways from you. One thing that we know for sure is that healthcare is a growth sector. It's a growth industry. There are huge, huge demands right now in the healthcare sector for veterans, for military spouses, because of some of the recent changes in the law and our economy adapting to that. I think the other thing that we found to be true with these panels is that a lot of the veterans who have made the transition are recommending getting basic skill sets in IT and information technology and having specific certifications that'll help them make the transition, because it becomes something that's necessary as part of a basic skill set. So I gave you a lot to digest there. If you could talk a little bit about the future of the industry and how it is a growth opportunity, and then if this IT thing, this genesis of IT skills as a necessity, if you could cover that as well, that'd be great.
Absolutely, Kevin. So yes, healthcare is definitely a growth area, despite the continued discussion on national healthcare and how the law is rolling out. I believe that companies like Humana and the company that Walt represents, we can all tell you that it's going to continue to grow. The demand for healthcare professionals, anything from delivery of healthcare to the actual health insurance that Humana provides, everything from A to Z that falls within healthcare, or providing care and ensuring that the care is accessible and affordable to the public, is going to continue to grow. I think that one of the things that I have learned here at Humana is that coming in as a veteran, even if you didn't have a healthcare background, a lot of the traits and the skills that we bring are transferable skills. It is what leaders in healthcare are looking for. Obviously, being honest, dependable, some of those leadership attributes, being part of a team, but also able to step up and lead a team. These are all attributes or things that leaders in healthcare are looking for. What we need right now is we need integrity. We need honesty. We need people to come in and be willing to listen and to learn, and not always assuming that you have the answer, because sometimes you don't. There's a lot of different debates and a lot of different discussions that are going on within healthcare. As far as the IT goes, Kevin, for everybody that's participating here, I would agree and disagree in the same time that IT within healthcare is a huge growth sector. At Humana, my experience has been within IT. It does require a lot of credentials, and a lot of times it's easier for me to get veterans transitioning out into other roles, and then once they go back to school or they develop those additional skills later on, then move them into IT. But no doubt IT is part of the backbone of the infrastructure between healthcare. As we continue to automate our systems, we go to electronic records. That is a big thing. As we integrate our systems between the private sector and the government sector so that we have streamlined communication that can speed up the results and speed up the healthcare that's being provided. IT is important, but again, unless you have those skills or those credentials as you're transitioning, it would not necessarily be one of those roles that I would highlight immediately.
That's great, Josh.
I would chime in with we're always looking for IT skilled folks. We never know, again, being a government contractor, exactly where and when they're going to need what they need when they need it. And so as a result, we have changes constantly, or they're going every day. And so our IT platforms change. We have a contract with the VA that's different from the contract with the Metcom, which is different from the contract with the RHRP. And so as a result, we need to know all of those. And if you've got any kind of IT skills, we're obviously involved and interested in that.
Okay, that was fantastic.
I just would add one more thing. LHI is not necessarily a medical arena. We don't do patient care right here in these buildings. What we do is a lot of desk work, a lot of admin work, but we need the healthcare professional who understands the paperwork or the types of vocabulary or types of illnesses or types of sicknesses or whatever. That's where we do not mind hiring nurse practitioners or physician assistants or dental review coordinators or case managers or nurse educators. We need all of those things.
Thank you very much, Walt and Josh, for your comments there. I'd like to just highlight a program that we recently put on VetNet, and that's also on the Hiring Our Heroes site, because I think it is in line with this last question, and we call it the Fast Track program. We just queued it up on the screen there. But this is a very simple approach to some of the challenges that veterans and transitioning service members are having. And this comes out of my own experience as a Marine. I was in charge of enlisted assignments and retention for the Marine Corps and spoke to young people every day about their decision to re-enlist or their decision to get out. It's a very simple concept. When young people leave the military, they generally focus on where they're going and not what they're doing. They make a decision of the heart. And what we want them to do is make an informed decision about where the jobs are and what industries are hiring. And healthcare is a great example. It's an industry that's growing, and what we want people to do is to focus on the 100 cities in America that have the fastest growing job markets. We want to show that to veterans. We want to show that to transitioning service members. So when they're leaving Camp Lejeune or Fort Bragg, like Josh and I did when we got out of the Marine Corps, and they're going back to a community across the country, they're going to consider, one, the fastest growing cities in America in terms of job growth, but also the industries that are hiring. So if you go to a city in Texas, let's just say you go to Austin or Houston or Dallas, and you click on one of those cities, it'll show you the job opportunities in those cities. We've developed this so that when you do click on it, it'll also show you the industries that are most prevalent in terms of employers that want to hire veterans. We used the Department of Veterans Affairs as the populating source. They have a site called the Veterans Job Bank, and all the jobs that are on the VA site are also in this map. The more we can get employers to populate the map, the more real data we have on job opportunities, career opportunities for veterans. I think we're gonna go to a couple more topics, but for the veterans that are out there, if you have specific questions about the healthcare industry that you would like answered, or for Humana or LHI specifically that Josh or Walt can answer respectively, please let us know. I think the other compelling thing, Josh, would be to talk about a very specific need that you're trying to get filled right now. I mean, if you had to pick the one job in Humana that you're looking for day in and day out, if there is one. I mean, if there's not, let's be honest about it. We can move on to something else, but we know healthcare is a growing industry. We know there are specific cities that require healthcare professionals. If you had to pick the one thing that a veteran, regardless of his skill set in the military, should focus on, what would that be? And maybe some of them will migrate to that because they have the GI Bill and they're making decisions right now.
Absolutely, Kevin. I can definitely give you one example, and that is, and it is transferable skills that most veterans, at least at the non-commissioned ranks and above, will bring to the table, and that is being a process manager or program manager. In the military, regardless of where you sat in the rank structure as a non-commissioned officer, senior non-commissioned officer, or even a commissioned officer, at one point in time you have led troops, you have led personnel, and you've had to basically form a process, form a team, and then lead that team and execute a mission. At Humana, we have no endless opportunities in process and program management. That's actually been a huge focus for myself and for the leaders at Humana, as we have brought veterans into the organization. I believe that if you came and looked at that Veterans Talent Network, Kevin, can you bring that site back up, our site?
Sure, we're going to bring it up right now. James is working on it. Just like a Marine to catch us off guard. It's up now.
Absolutely, it's all good. Hey, when you're looking at our veterans portal, there is that easy search bar. You could literally type in process or program manager into this site and search, and you will see these opportunities all over the country. You can further build that profile by actually adding a location to it. Louisville, Kentucky is our corporate headquarters. We have over 14,600 associates in Louisville alone. And so as you're looking at opportunities, if you're in the Louisville area or willing to relocate to Louisville, process and program managers are in abundance in Louisville. But I can tell you some of our other markets are Phoenix, Arizona, Tampa and St. Petersburg, Florida, Dallas, Texas, just to name a few. And so if you're looking out there, process and program managers, they're in abundance all over in all of our markets, and they're even in some areas that are smaller. So that would be one of those areas. I believe that our opportunities and abilities to come in and lead, to be problem solvers, make us effective process and program managers. So I'll turn it to Walt now.
Yes, they've asked me to talk a little bit about one of the areas that is easy for you to understand, and that would be our nursing careers. Most of our nurses do not do patient care. In fact, all of our nurses do not do patient care. However, they are constantly, daily, reviewing paperwork. For instance, that PHA that Kevin had talked about at the beginning, the periodic health assessment, is done worldwide. And all of those are we come into this headquarters and are reviewed by the nurses. And they're reviewed for completeness, of course, but they're reviewed for all of the sicknesses and diseases or any kind of physical ailments that somebody may have. And then the nurses will recommend, and again, we need to let everyone know that with RHRP, we can only recommend whether a soldier be or a sailor or an airman be mobilized and deployed. We just recommend. But however, we look at their past PHAs, we look at their past medical history, we look at what this is a self-health assessment, so as a result, they review everything that the soldier says, and including what the healthcare provider says. And they review all of that, and then they make a recommendation to the commander of the unit that this person needs a profile or needs a temporary profile or something to that effect, or nothing at all. They may be very healthy, in which case you may have heard the saying picket fence. they get ones all across the board. But as a result, these healthcare providers are not making beds, and they're not doing bedpans, and they're not taking care of patients. They're taking care of paperwork, and that's one of the areas that we do hire for.
Thanks, Walt. I think you did a great job kind of talking about the things that are really practical. I'd like to kind of wrap the panel up now. If we have any questions in the meantime from veterans, please ask them now. We got about 3 or 4 minutes to go live, and then we'll shut down here. And certainly you can come back and visit these panels. Josh, I'd like to ask you, if there's any points we missed that you'd like to make regarding Humana, to go ahead and chime in now and let us know if there's anything else you want to impart to especially to the younger veterans who are listening.
Absolutely. I believe the biggest thing that I have learned in my transition, I've been out now for 4 years off of active duty and just completed all my reserve time. So I'm a civilian again. I think that one of the things that I have learned is that we should aim high. So kind of borrowing from the old coin term from the Air Force, we can always aim high. As the Marines say, adapt and overcome. And I think the ways that we do that is by basically finding 2 mentors. One of those mentors needs to be somebody that knows us and knows our weaknesses and our strengths, and ask them for honest opinions about ourselves. And then the second one is having a mentor that's in the industry, business leader. And I think if you have 2 of these different mentors, one's going to give you a very honest perspective of yourself, and the other one is going to give you kind of a gauge of what you need to do to grow. I think that that's really going to help you in your transition and as you're searching out career opportunities. As far as Humana is concerned, we're here to support. We have a lot of veterans now in the organization. Anywhere between 7 and 10% of our organization are veterans or spouses. And one of the things that I'm starting to work on in the future is having other opportunities for more of the veterans in Humana to be accessible to veterans that are transitioning and looking at Humana as an employer. So again, if you use our Veterans Portal, that's one way that you can connect with us. And then we help to marry you up or match you up with recruiters and hiring managers in Humana. And really encourage you to take advantage of the portal that Humana has built, and continue to be on platforms like this, VetNet and Hiring Our Heroes. And thank you again, Kevin, for having us here on the panel today.
I would just like to say that I want to thank Kevin for the opportunity to do this, and I'd like to thank Joshua as well. Everything that Joshua said, I hope everybody really listened carefully to what he had to say, because he had some very excellent points. LHI currently has about 10% of veterans out of 850 employees, but we're looking to go to 20% in the next 3 to 5 years. And that's a challenge to us, but we've been to all of the schools, and we've been to job hiring fairs, and we constantly do things like this to let everybody know that there are jobs available for veterans. Thank you, Kevin.
Fantastic to both of you. I think that was a great way to close the panel. I think for the veterans who are listening, the one takeaway for them is there's thousands and thousands of opportunities in the healthcare sector, and some of them have the skills to translate directly in there, and some of them have the capacity to learn those new careers and make the transition relatively easy to the healthcare sector. So I think the takeaways for the veterans that are listening is to tune into VetNet as much as possible. If you're at the very start of your search, if you're looking to transition soon, there are going to be a lot of tools that are out there. For example, to start the new year, we're going to have an energy panel as well as a government panel. A lot of veterans are interested in government work as well. I appreciate Josh and Walt, you joining us, taking part in this, imparting your own wisdom and experience on the younger veterans who are listening. And to all the veterans that are out there, thank you for tuning in. We hope that VetNet becomes a viable alternative for veterans who are transitioning out of the military and who are recently transitioned and having trouble finding work. So thank you everyone for joining. We look forward to future panels and working with you.